gather the appropriate equipments.
Good morning po, sir. For today, I'm your student nurse Julian JB Ilagan from LPU Cavite. Sir, I will check your identity. Sir, can you state your full name po?
Ilagan,
What's your birth date?
May 21, 1996,
What's your age?
26.
So, sir, today po I will be assessing your neurological status. This assessment will include assessing your mental status, cranial nerves, motor and sensory function, pupillary response, and reflexes. With this po, you will just follow my simple instruction in order for me to check properly your neurological status. Sir, I rest assured that all the results that I will be getting for this procedure are all confidential and safe po. Sir, no worries po. So, sir, do you have any questions or any clarifications?
None.
And after that, we can perform a hand hygiene. Provide the client with the privacy, safety, and dignity, and place the client in appropriate position. So, with this po, sir, can you change your clothes in a lab gown? In next po, sir, I will be inquiring your health history regarding your neurological. Sir, I will be asking your history po. So, you can answer po yes or no po. So, sir, do you experience headaches po?
No.
Have you experienced seizures or
No.
rapid loss of consciousness?
No.
Do you feel dizzy or lightheadedness
No.
or other problems within your balance or coordinations?
No.
Have you experienced numbness or tingling?
No.
Have you noticed a decrease in your ability to smell?
No.
How about in taste?
No.
Have you experienced ringing in your ears or hearing loss?
No.
Have you noticed any changes within your vision?
No.
Do you have difficulty understanding when people are talking to you?
No.
Do you experience difficulty in swallowing?
No.
Have you lost bowel or bladder or retained urine?
No.
Do you have muscle weakness or any loss of movement?
No.
Do you experience repetitive involuntary movement?
No.
Involuntary trembling?
No.
Shaking?
No.
Do you experience memory loss?
No.
Next po is about the past health history. Have you ever noticed any type of head injury with or loss of consciousness?
No.
Have you ever had meningitis or injury in your spinal cord?
No.
Or any stroke?
No.
History. Is there a history in your family like mga high blood pressure, stroke,
Wala. No.
Alzheimer's disease?
No.
How about epilepsy?
No.
Brain cancer?
No.
Sir, do you intake prescription or non-prescription medication?
No.
Hope you don't mind, sir. Do you have ever used marijuana or before, like other drugs?
No.
Do you smoke?
No.
Do you wear your seat belt when riding in a vehicle?
Yes.
Can you describe what food you typically eat in a day? Have you ever noticed prolonged exposure to lead or insecticides?
No.
Do you frequently lift heavy objects or perform repetitive motions?
No.
Sir, good morning po, sir. Okay po. Sir, can you state your full name po?
I'm Ilagan,
Can you tell where are you now?
in hospital.
What month today po?
June
Date po?
22,
Year po?
2022.
When is your birthday po?
May 21, 1996.
Do you know who is the president right now po?
Yes.
Sino po?
Marcos.
While asking the client, observe the appearance and behavior of the
Do you
patient.
feel any depression or anxiety
No.
or being unhappy?
No.
Sir, can you repeat 5, 10, 15, 20?
5, 10, 15, 20.
How about in reverse po?
20, 15, 10, 5.
po. Subtract 95 minus 5.
95 minus 5, 90.
Can you spell your name backwards po?
R-E-M-O-J.
Sir, can you multiply 8 times 5?
40.
Can you repeat the words that I will say po, sir? Barbie, barbecue, boss.
Barbie barbecue boss.
Okay po, sir. With this po, sisingap po kayo dito po. Ilabas nyo po yung mga mucus nyo po. Okay. Pikit po kayo. Tapos, takpan nyo po yung ilong nyo po. Ano po yung amoy po nito? Ano po ito?
Toothpaste.
Ano pong amoy?
Toothpaste.
About po to, sir.
Peanut.
Kabilang ilong po. Ano po?
Peanut.
Next po, I will be checking your visual acuity po. With this po, we're checking with this in a Snellen chart. We'll follow my instruction po. Sir, takpan niyo po isa niyo pong mata and basahin niyo po yung nasa Snellen chart po natin. So, start na po kayo sa letter E po.
E. F. E. T. O. Z. L. P. E. D. P. E. C. F. D. E. D. F. C. Z. P. F. E. L. O. P. Z. D. D. E. F. P. O. T. E. C. L. E. F. O. D. P. C. T.
Next po is kabilang mata niyo po.
E. F. P. T. O. Z. L. P. E. D. P. E. C. F. D. E. D. F. C. Z. P. F. E. L. O. P. Z. D. D. E. F. P. O. T. E. C. L. E. F. O. D. P. C. T.
And then ask the client without covering his eyes.
E. F. P. T. O. Z. L. P. E. D. P. E. C. F. D. E. D. F. C. Z. P. F. E. L. O. P. Z. D. D. E. F. P. O. T. E. C. L. E. F. O. D. P. C. T.
Okay po, next po, sir, ay babasahin niyo po yung nasa book po. Sir, pakibasa po ito.
Simple staining which uses only one dye. The dye adheres to the cell wall and colors the cell, making it easier to see.
So, next po, sir, with this po, tatakpan niyo po isa niyo pong eye and you will say yes po kapag yung object po is lalapit po. In your right eye po, sir. Say yes lang po.
Yes. 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 Yes.
Left eye po.
Yes. 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 Yes.
Test for the cranial nerve 3, 4, and 6. Inspect the margin of the eyes, extraocular movements, and pupillar response to pen light.
Sir, next po is susundan niyo. We'll be checking your pupillary response po. With this po, I will be dimming a light po and using my pen light to observe your eye po.
Assess for the pupillary light response in indirect and direct, and accommodation in both eyes.
Tingin po kayo sa ballpen ko po in a near sight and a far sight po. On the object po, sir. Far sight po. Natingin. Near sight po. Far sight po. Near sight. Next po, sir, is you will follow the movement of my pen po. Mag-flench po kayo ng teeth niyo po. And I will be palpitating. Sir, next po is I will be assessing your pain po. With this po, you will say dullness or sharpness po, and say what's location po.
Sharp. Sharp.
Saan po yun?
Sa hita at sa noo.
Po.
Dal. 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 Sharp. 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 Dal.
Sir, I will be checking your cornea po. I will be using my cotton po. Tingin po kayo sa malayo po. Next po is smile po kayo. Frown po. Wrinkle your forehead po. Show your teeth po. Puff out your cheeks po. Purse your lips po. Raise your eyebrows. Close your eyes with resistance po. Yung pilit. Next po, I will be checking your hearing po. I will be doing Weber and Rene test po. With this po, you will say what's area or the area A or area B is louder po. Saan niyo po narinig?
A.
Next po is the next ear po.
A.
Next po, sir, is open your mouth po. Say up po.
Ah.
Next po, kabila. Third po is mas malaki pong buka po ng bibig. Sir, next po is swallow po kayo ng water. Sir, shrug your shoulder po. Yan, may resistance po. Tingin po kayo. Sir, up po kayo. Move your tongue in left po. In right naman po.
Document the findings in the client's record.
Your findings po, in your cranial nerve 1 po, you correctly identify the scent po, and in your cranial nerve 2 po, you have a 20/20 vision, and in your right eye and left eye po, and you read the print at the 4 inches without hesitation po ng pagbabasa. Visual fields, and you have a round reflex is present, and optic disc is 15 mm, round and slightly oval. And sa cranial nerve 3, 4, and 6, you have a intact, as well as your cranial nerve 5 are all is intact and no abnormal findings. And your eyelid covers about 2 mm in your iris, and your eyes move smooth, coordinate motion in all directions. And bilaterally illuminated pupil constricts simultaneously, and your pupil opposites to once illuminated constricts simultaneously. In your cranial nerve 5, temporal and master muscle contract bilaterally. In cranial nerve 7, client smiles, frown, wrinkle forehead, show teeth, puff out cheeks and pursed lip, raise eyebrows, and close eyes against resistance. Movement are symmetric, and in your cranial nerve 8, you hear the words from 1 to 2 feet in a Weber test, heard equally well in both ears. In Rene test, AC is greater than B and C. In your cranial nerve 9, uvula and soft palate rise bilaterally and symmetrically. And your cranial nerve 10 to 11 are all intact, which indicates normal. And There is a symmetric and strong contraction of trapezius muscles and cranial nerve belt. Tongue movement is symmetric and smooth, and bilateral strength is apparent. Next po, sir, is maghahap po kayo, like this one po. Next po, kabila po. Sir, stand up na po kayo and follow my instruction po. Sir, dyan po kayo. Okay. Walk na po kayo. Backwards po. Okay po, sir, tayo na po kayo. And harap po kayo dito ng konti. Okay po. And your feet po, wag medyo, and put your hands po sa shoulders niyo po. And close your eyes po. And we will wait 20 seconds po. Open nyo po your eyes naman po. And we will wait 20 seconds again po. Your next po is finger to nose po, like this one po. Follow po this one po. Next po, may hand po. Finger nose. May hand po. Finger nose.
For the findings, in test, condition, and movement of a muscle, there is a muscle is fully developed and symmetric in size, while in test imbalance, gait is steady, opposite arm swings, and lastly, in test coordination, client touches the finger to nose with smooth, accurate movements.
Sir, close your eyes and tell me what you feel.
Dullness. 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 Dullness.
Pili po kayo. You will say sharp or dullness po.
Sharp. 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 Sharp.
Pigit po ulit po kayo. Say hot or cold po and
Cold. Hot. Cold. Hot. Hot.
next po, sir, I will be assessing your tingling sensation po.
Tingle. Harap. Tingle. Tingle. Tingle.
Sir, can I have your foot po? Sir, pikit po kayo. You will say up or down po when you feel it po.
Up. Down. Up. Down. Up. Down. Up. Down.
Sir, is close your eyes again po. Can I have your hand po? Can you identify this object po?
Correction tape.
Next po, close your hand po.
Marker.
For the findings, test light touch, pain, and temperature sensation. Identify light touch, identify dull and sharp, identify hot and cold. For the test 2 vibratory sensation, may client identify sensation. For the test 3, test position sensation, may clients correctly identifies direction of movement. For the test 4, the tactile discrimination or the fine touch, may clients correctly identifies the object.
Next po.
Ask the client to be in a supine position. Ask the client to be in a supine position for plantar reflex.
Like in the superior and medial area of the thigh, just next to the testicles.
O kaya mga injuries within your neck po?
Wala.
Since you are in a supine position, I will be removing your pillow.
Sir, your hips and knees remain relaxed and motionless.
With this po, I will be lifting your legs po. Okay, sir, what do you feel po right now?
No pain.
This is a positive sign. Sir, thank you for cooperating to me.
Document the findings. For the findings in test deep tendon reflex, his bicep, bronchodialis, triceps, patellar, Achilles, and ankylocus has a 2+ which indicates normal. And for test superficial reflex in plantar abdominal and masteric indicates all normal. For test 3, meningeal irritation or inflammation, brooding skin sign, hips and knees remain relaxed and motionless. Kernig signs, no pain felt.